Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
At African Diaspora News Channel, we cover stories that don't receive mainstream attention, and we serve as the voice to the global Black community. We are committed to informing and educating through the power of media, connecting the African diaspora one story at a time.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
Welcome to Africa Diaspora News Channel, where we bring you exclusive stories around the world. And my name is Lynient Akotonou, making this report. The Trump administration has issued a 90-day freeze on foreign aid, halting the funding of the PEPFAR, which is the President's Emergency Plan for Aid Relief. This has been instrumental in combating HIV and AIDS globally since 2003. This funding has invested over $85 billion in 54 countries, saving 17 million lives. And it has invested $6 billion in Nigeria alone. Now, with Trump cutting the funding to PEPFAR, I would say Nigeria is in for a ride. And why is that? Nigeria has the world's second highest number of people living with HIV. And if HIV is not treated, it develops to AIDS, which can lead to death. However, these drugs are expensive and are only available on donation. Now that this donation has been cut, Nigeria has to rise up to the occasion, else the number of infections will increase, which is currently at 200,000 every year. Not just that, HIV will lead to AIDS, which on the long run will lead to the death of lives, since there are no drugs to cater for the needs of the infected. And our already burdened healthcare system will further be burdened and hopefully doesn't fall. Former President of Kenya, Uhuru Kenyatta, urged African leaders to view the decision of Trump as a wake-up call to self-sufficiency. I mean, it's time for African leaders to pick up their mat and work. It's time for them to do things themselves. They do not expect to be spoon-fed always. I do not totally agree with the cutting of the fund. Well, my opinion, because we have other developing countries that do not have the resources. But for a country like Nigeria, I mean, they do not invest in their healthcare. The leaders travel out, so they feel it's okay to just travel out because you are receiving aid from somewhere. They don't really invest in it. That's why there is looting here and there. Just one person loots trillions of naira, and then there is no accountability whatsoever. How money is spent, money comes in, and then we are still in debt. But now that we are left alone, we will try to be self-sufficient. Our only cry is that the poor do not suffer this. Yes, the poor do not suffer because our leaders do not actually care about us. Now, Nigeria has oil. Nigeria has the remittances cutting from the African to diaspora. Nigeria has agriculture. Nigeria has vast land. Fertile land for agriculture, agricultural potential. Nigeria has human resources. If we focus all these resources on the right path, I mean, we'll be debt-free in a number of years. But no, check out the infrastructure, the healthcare system in Nigeria. Chinonso Egemba, popularly known as Aproko Doctor, posted a video on social media of the deplorable state of the healthcare system in Gombe State. I mean, they don't even have electricity. Well, let's watch the video.
This is where women give birth. That's the toilet. This is where people give birth. In this primary healthcare center, this is the only forceps in this entire place. They don't have more than this. When women come at night to give birth and there's no light in the hospital, how do you take their deliveries?
Well, you're just using our phone, torchlight.
You're using the torchlight of your phone to take the deliveries.
Yeah.
What if there's bleeding? How do you know where it's bleeding? Have you seen the problem that we're facing in this country? That is the electricity that is powering this entire hospital. If your leader is not serious about the primary healthcare center, they are wasting their time. Because the primary healthcare center is the first level of healthcare in any country, any state, any local government that is serious about healthcare. This hospital does not even have adequate solar care. There's no lights. There are women who give birth in these hospitals. You can see what the labor room looks like. There are people who are going to need wound care. You can see what the wards look like. There are children who require help from this hospital. You can see what the resources look like. vaccines have to be imported from another hospital just so that they can be given to the people here. But no worry, you can scroll because this is not bomb or funny or whatever it is. Tell your leaders that they should focus on primary healthcare centers and not be building fake ultra-modern hospitals everywhere when this is neglected, because everybody everywhere actually deserves access to the highest quality care possible.
Can you say this? It's time for African leaders to take their nation seriously and invest in it. Yes, they have to invest in their nation, not expecting relief from somewhere or donation from somewhere. So this is actually a wake-up call. It should open the eyes of these politicians and our leaders to see that they have a lot to do. Yes, they have lots to do. They have to cover ground and make sure things are available. Health sector, most importantly, they help people are dying daily. People are dying due to the deplorable state of health in Nigeria. Hopefully, this decision doesn't cause a ripple effect on the poor, because things will actually spike up again. Things are likely to increase. And we now have a high risk of this virus transmission. So everyone, be careful out there. What are your thoughts about this story? Comment below and do not forget to share, subscribe, and turn on your notification button. My name is Lynient.